Today we're with Dr. Goya Raikar, Medical Director of Regions Hospital Cardiovascular Surgery Department. Dr. Raikar, describe what a typical day is like for you at the hospital.
Well, a typical day starts pretty early, about 6:30 in the mornings, and then I start making rounds in the intensive care unit on our patients and on the floor. And usually then we end up in the operating room about 7:15, 7:30 to start our day in the operating room. And that consists of either one or two cases. These sometimes are long. Heart surgery is not, outpatient surgery, so a lot of times the cases are 3 to 4 hours in length, and then there's some downtime in between for me to catch up with meetings. By about 3 o'clock, I'm done. If it's a robotic case, a Da Vinci case, we try to do only one of those a day, just because of all the expertise that's needed and sort of all the players that are needed for that type of surgery. But that's sort of a typical day.
Great, let's talk a little bit about the Da Vinci. What is it like to work with this surgical robot, and where did you learn such a skill?
Well, I think it's fantastic. I'm now in the 10th year of my practice, and when I was in training 11 years ago was the first iteration of the robot, or the Da Vinci system. We're now in the 4th iteration, I think, of this Da Vinci SI system. But that's where I got my first view of what surgical robotics could help us do. And as a heart surgeon, it excites me because obviously what we do is very invasive most of the time, and patients take at least a good 2 months to recover. What the robot allows me to do is things with so much dexterity with small, tiny incisions. And obviously that translates to faster recovery.
So in your experience, and you just went over kind of one of the benefits, are there other benefits of robotic surgery to your patients?
I think the few things that we've seen, as opposed to thoracoscopy, or people talk about laparoscopy, it's all two-dimensional. The robot is three-dimensional. You're immersed into the environment, and the manual dexterity you get with that is incomparable. The benefit, I think, is we can get into complex operations, let's say a mitral valve repair, which sounds daunting. And it is, even in an open setting. I don't think I can see as well as I can with a robot. And a lot of my colleagues that have used the robot across the country and across the world have paralleled those thoughts. So that's exciting.
Well, let's look forward. 10 years.
Sure.
What do you think heart surgery will be like in 10 years?
Well, I always kid around. I think my 14-year-old and my 10-year-old, when I first got started on this robot thing, says, "Well, what is a robot? Do you push a button and then, the robot does everything?" And I said, "No, Connor, that's not what it is. It's Daddy controls the arms of the robot." What I think as technology improves, you will see more automation. You will see more miniaturized robotics. And I think in the next 10 years, if we're not doing a majority of things more minimally invasive without the sternotomy, I would be surprised.
Well, great. Well, we'll look you up in 10 years. Thank you very much for your time today.
Thank you for having me.